I've seen so many people with a chronic cough recently. So here are 3 common reasons that someone might be coughing for weeks or months on end and antibiotics and x-rays haven't made any difference. And the third one, you're definitely going to want to hear. The first is medication related. So there's a group of medications called ACE inhibitors. Examples are ramipril, lisinopril, perindopril, captopril, and all of these are used to treat high blood pressure. Now, any of these can cause irritation to the airway, which can lead to a dry cough. It can be chronic. This is one of the most common side effects of the medication, and it usually settles within the first month, but it might take a bit longer. So if you can persevere with it, carry on. If not, it'd be worth having a chat with a clinician to see if you can be changed to something else. A second common cause would be asthma. So you might have asthma if you have breathlessness, a wheeze, if your symptoms are worse, first thing in the morning, last thing at night, or even on exercise or exertion, or even if you're exposed to allergens. Interestingly, around 1 in 4 people with a chronic cough will have asthma, and the treatment is very straightforward. We just use inhalers to try and open up the airways, relax the airways, reduce inflammation in the airways. And there is a very clear stepwise approach to asthma management. Sometimes tablets are used on top of the inhalers. And finally, the one that you've been waiting for, pertussis, whooping cough. Now, it's not a conspiracy. Doctors aren't trying to hide it from you. It presents, it's got multiple different phases to the illness. The first 2 to 3 weeks is usually very similar to any other viral infection with a cough, fever, runny nose, sore throat, muscle aches, tiredness. But it's usually in this second phase where you start developing this really loud inspiratory whoop in between coughing fits, and you have very severe coughing. You might vomit after a cough. If you're deemed to have whooping cough and you're early in your illness, you might be given some antibiotics. If you're not, then treatment is generally supportive with self-care advice and managing close contacts. Send this to someone who has a chronic cough.